Concern is growing this morning for celebrity blogger Perez Hilton after a mental health emergency at his Florida home.
Deputies responded after reports he appeared to be harming himself during a TikTok live stream. The sheriff's office says that he was safely recovered and taken to a local hospital for medical care. Crisis response teams and licensed mental health professionals also responded to support his family.
To talk more about Perez Hilton and, more importantly, taking care of your mental health or someone that you love, we're joined by the Executive Director for National Capital Area American Foundation for Suicide Prevention, Ellen Shannon. Ellen, thank you so much for joining us. I'm not sure if you saw this disturbing video here, but just as a professional, what can you assess from what the world saw from Perez Hilton?
Well, I don't want to speculate on what he's experiencing or going through right now, other than we just want to make sure that he is reaching out and getting the support that he needs to help him heal and recover. But I just want to really stress to everyone to really try to limit your exposure to this particular event and to instead seek more positive messaging and resources to help you or any loved ones you may be concerned about.
All right, so what does effective de-escalation look like when someone may be at risk of harming themselves?
Absolutely. And this is really important to learn because we know that suicide is in fact preventable and that everyday heroes like you who are out there listening right now can play an effective role in preventing suicide. So I always want to say, please inform yourself about what the risk factors and protective factors are associated with suicide. Some risk factors to look out for, or past histories of trauma. Any kind of talking about suicide is certainly a warning sign we want to look for as well too. But we really want to educate ourselves on how to help someone when they are struggling as well too. So if you're seeing any of the warning signs, like talking about suicide, Googling access to lethal means, talking about being a burden to others, feeling hopelessness, behaviors of isolating yourself or retreating from activities that you normally enjoy. Of course, there's some more obvious ones that I think we all associate with suicide, like experiences of depression and things along those lines. But we also want to look for things that may be more subtle, which include experiencing rage or practicing really unsafe or unhealthy behaviors and misuse of substances or alcohol misuse as well too. But if we know or if we trust our gut and we see that someone may be struggling, we want to make sure that we reach out to them and offer support. And so what that can look like is reaching out to have a caring conversation. Of course, you always want to do this in private. And you really just want to express that you're caring and concerned for them. And then what we really want to do is more listening than we are doing talking. And so ask them, how are things going? I've noticed XYZ changes in your behavior, and that has me a little worried about you. And so are you struggling? Are you thinking about suicide? And then, of course, you want to listen to what their response is. And based on their response, you can take appropriate steps following up. We always say it's really important that if you think that someone is considering suicide, you want to ask directly what the question is. So you want to use the word suicide. Are you thinking about suicide? And if they say yes, or maybe allude or give you the feeling that they might be considering suicide, you want to ask them if they have a plan and listen to what they're saying in that, because we know that if someone has a plan, that of course puts them at increased risk themselves. And then it also gives us information about the steps that we can take to create a safe environment. So if they are struggling or experience a moment of crisis, that we can keep them safe in that moment and have a protective plan to help them.
Such great advice. And if somebody right now is struggling, or a family member or someone that you love, what do we need to do, the viewer, right now?
I want to express that you are absolutely not alone. Suicide is something that impacts the majority of Americans at some point in their life in one way or another. And I can tell you that we want you here. We need you here. Many people care about you and love you. And there's so many resources and support where you can find help to get you through a challenging moment or time in your life. You can always go to the American Foundation for Suicide Prevention's website, which is afsp.org/get help. And on there are many resources to support anyone who is struggling themselves, to support someone who is worried about a loved one, to support someone who has experienced a suicide loss. And really, no matter what your connection to the cause, we have resources to teach you about risk factors, warning signs, protective factors, but also where to find support in your community, whether that's through finding mental health resources for support groups, you name it. So please connect with afsp.org. We have an abundance of resources out there. And wherever you are tuning in from, whether you're here local to the DMV area or you're streaming and watching this from somewhere else in the world, we have a nationwide presence, 73 chapters in all 50 states, DC and Puerto Rico. And so no matter where you are, you can absolutely connect with your local chapter and find a community of support to help you on whatever your journey may be.
All right, Helen, thank you very much. Very important information there.